Hi, my name is Ann Rajkumar, and I'm at PGY5 at Vanderbilt University, and I'm here to talk about the integration of plan review into our resident clinical didactics. Our background is that, like many academic institutions, our clinic is busy and our attendings have satellite coverage, leading to uncommon contemporaneous plan review between attendings and residents. And so we sought to increase our informal instruction and plan review. Our intervention was to propose new once-weekly didactic following chart rounds called a plan review session. And for this, we invited our 13 attendings to present one or more cases that they thought would be educational or interesting. We encourage attendings to present patients from recent chart rounds to reduce prep, since these cases should be fresh in their brains. And also, they were scheduled to present in cycles, with each attending presenting once over a circa 4-month cycle. And we plan to gather feedback via surveys after about 2 cycles. Our results for that 12 attendings hosted 22 plan review sessions over a total of 37 weeks. There were a total of 5 times that last-minute schedule conflicts arose to attending not being able to do their originally scheduled session, in which case we used an Astro Aero treatment planning webinar to fill in. Overall, attendings reported a low burden, with 50% of them spending 30 minutes or less prepping for a plan review session. And 2 of them also voluntarily made very thorough PowerPoint presentations to introduce their approach to plan review. Most sessions featured in-depth education featuring just 1 to 2 plans. And yes, we really did spend 45 to 60 minutes talking about just 1 or 2 plans. A wide variety of sites and topics were covered, and 6 out of 22 sessions featured complex management, which were either B plans for patients currently on treatment or reirradiation. And overall, from resident feedback, they felt that plan review sessions should be continued, that they strongly enjoyed attending plan review sessions, that plan review sessions filled an educational gap, and that residents were more interactive during a plan review session than our regular didactics, and that plan review sessions were useful for their current level of learning regardless of PGU by year, and that during plan review sessions, attendees share plan insights and treatment plans that are not otherwise shared. And we did indeed really like that deep dive into 1 to 3 cases compared to reviewing more. And they again felt that live plan review sessions were more engaging than the recorded webinars, but still appreciated having those webinars included because it gave us a view into treatment planning at other institutions. Attending feedback was similarly positive, with the majority believing that plan review sessions should be continued, with a strongly agree, and that the majority also strongly enjoyed leading plan review sessions. They similarly felt that plan review sessions filled an educational gap and felt that residents were more interactive during them. For some parting comments from residents, they love seeing how an attending evaluates the quality of a radiation plan, and seeing them work through their priorities is extremely valuable. And another absolutely loves plan review sessions and believes they are the best part of didactics. Please continue. In conclusion, implementing the plan review session was rapidly done, with an 81% success rate of having live attending-led sessions in eligible weeks. And we covered a wide variety of topics without assigning attendings particular topics or sites. And that residents and attendings agreed that plan review sessions are enjoyable, valuable, and should be continued. And the burden on attendings was overall low and not an impediment to continuing the program. Our next steps are to incorporate review of rejected plans and to integrate onboard imaging when available, and also to expand to other interested institutions. Speaking of, are you interested? If so, please feel free to reach out for tips to either myself or Austin Dove. And to acknowledge Austin Dove for the initial idea and for running the program while I was out on maternity leave, who is also going to be carrying it forward next year. And also Daniel Golden and Natalie Lockney for their mentorship and support on this project. Thank you and goodbye. See you in Chicago.